All right. Thank you, everybody, for joining us today for masks and vax in the workplace. When I came up with this topic a few weeks ago, it was supposed to be sort of a refresher course as we move into the fall. And then I went away, I put the deck together and I went away on vacation and came back and I had to update it because the last 2 or 3 weeks have seen some changes, largely thanks to our friend, the Delta variant. So we're happy you're here today to sort of re-energize this conversation. Unfortunately, we need to re-energize it after a couple months of maybe a little bit more less anxiety around masks and vaccines. Now we're looking at, as you probably read in the news, there are more organizations that are ratcheting up their policies and looking towards the fall in terms of CDC guidelines and what works best for their organization. So hopefully today we can answer all or some of your questions. And as always, we'd love to hear anecdotes from the field about things that you are doing at your organization that can our listeners would find helpful. Special quick shout out to my friend Sarah Barker, who is on here today. She and I spoke earlier this week and just wanted to say hello to her, and also Mark Brickey from the Virginia Employment Commission. Hope things are going well there. All right, so my guest today, as you guys probably know, is Kim Alexander from Mineral. How are you, Kim?
I'm doing well, thank you. Happy to be here.
I know. I wish we were talking about a different topic, but we are back on this topic, and
here we go again.
Here we go again.
Yeah.
But we are, here for you guys to answer your questions. And Kim, as you all probably know, is our partner at Mineral, which used to be Mammoth Think HR. They've rebranded, and she is just a fantastic resource, both for me and for clients around all things human resources. So we thank you for your time, Kim. I know you guys are also very busy.
Oh, I'm happy to be here. Thanks so much for having me.
Mm-hmm. All right, a couple housekeeping reminders. We are recording this webinar, and we will post it on our website by the end of the day today on our COVID-19 resource page. If you have a question or an anecdote, please use the Q&A function as opposed to the chat, just so that we can record those questions later and refer to them later. And then if you prefer to submit your question in a different format, you can send it to questions@dominionpayroll.com, and that will route to either me or the other members of my webinar team, and we'll get back to you with an answer. And you don't have to be a Dominion Payroll client to submit a question. I know some of you might not be clients, and that's fine too. We're happy to help either way. All right, so we're going to do a poll today, guys. I've recently become a fan of polls, and I think they're a great way to get some data from our audience. So bear with me. It's not a long poll, but if you feel like answering it, please do. Okay. Here comes the first one. Can you guys see that? Kim, can you see it?
I can, yes.
Okay, so the first question is, what is your current workplace policy with regard to masks? So you either are implementing the honor system, where you are trusting that unvaccinated employees wear their masks at work. You have an incentive system where you are not requiring masks or vaccines, but you're really asking for folks to, you're incentivizing them or encouraging them to disclose their vaccination status. You have a verification system where you have if the employee is not wearing a mask, then they need to prove that they are vaccinated. Maybe you have no system in place, or maybe there's something else. It looks like a couple of you have marking the other box. So I'm aware that this is a single choice questions. So perhaps you have sort of a hybrid system based on the type of employee that you have. Looks like the honor system is winning out. Nobody's doing the incentive system. And then a few of you are doing the verification system. A few of you don't have a system. And then quite a few of you have selected others. So I'd be interested in hearing about that. Then the second question, what's your current workforce policy with regards to the vaccine? Strongly encouraging, requiring all new employees, or we do not have a policy, it's up to the employee. So it looks like everyone who wants to answer has answered. So I'm going to go ahead and end the poll, last chance, and share the results. Okay, Kim, can you see the results?
I can, yep.
Okay. So question 1 looks like there's a tie between the honor system and other. So if you're interested in sharing what that means, please do so in the Q&A anytime during this hour. The incentive system is not popular among this crowd. There are a few of you that are actually verifying vaccination status, and then a few of you don't have a mask policy in place. And then moving down to the vaccine, looks like the majority of you are strongly encouraging, incentivizing employees to get vaccinated. Just 2 of you are requiring it. 1 of you is requiring it of new employees only, and then 10 of you don't have a policy in place, and then a handful of you have selected other. So perhaps today, after today, you will be able to have the tools you need to craft a policy if that's something that is something you're interested in. Okay, it looks like some of my people who checked other said that we are requiring masks for everyone now. I'm assuming that's regardless of vaccination status. Michelle also says we are requiring a vaccination, but not asking for proof. I don't really understand that piece, but that's what I was told. Totally understand, Michelle. And then Gretchen says we require everyone to wear masks in the public areas, but not in their office. And I think that's a common practice too. It depends on your setup, of course. So if that's something that's workable for your workplace, I think that's a great option as well. Anything to comment on here, Kim?
I would just say I'm encouraged that it looks as though most do have some sort of policy that they're following. And I think that's good. I think, we are at the stage and we should know by now that we do need to have some sort of plan for addressing particularly safety in the workplace. So that's encouraging.
Yeah, and I think I was talking to a client yesterday, and basically it's like every 14 days you should probably evaluate it. I hate to say that, but that's how quickly things are changing. And when you release these, communicate these policies to your teams, let them know that you as an organization, you appreciate people's flexibility, and that you're trying to be as nimble as possible. But the data changes. I know at least 3 states now have across the board mask mandates. I think it's Hawaii, Louisiana, and Oregon, and that number could grow. So we're sort of back into that place where you need to monitor things, and having a policy that's designed to be a fluid document is probably the best way to go as we head into the fall.
I think we're also back to where you want to bookmark the CDC site because, as you said, information is coming out daily. Most likely, from what I hear, this Delta variant is going to get worse before it gets better. So guidelines change. We've been through this already. I think, if we went back to last year when the pandemic first started, we were given some information kind of right away. And then after we were able to study it for a little bit, then we kept getting updates. So more information that we had, the better. I think we're in that situation now where, again, we're going to get rapid information because they do have some knowledge of it based upon the way it acted in other countries. So here we go again.
Yeah, I know. And we don't mean to sound scary. We just want to be realistic and make sure you guys are prepared.
Right.
Okay, so some things to consider. So the 7-day average is up 36% from the week prior as of last Sunday. The majority of these cases do come from the Delta variant. As we all know, the schools and colleges are starting up again as we head into September. We now know that vaccinated people may unknowingly pass the virus to those around them. And that's the fact, that's the new information that's driving a lot of these new mask policies. And then because of that, CDC is now recommending that even vaccinated people mask up indoors in areas of high transmission. which, as you might recall from last year, high transmission, that's great for them to say that, but what does that mean? So I wanted to share some data with you all that like changes daily. But this is a USA Today data that you can bookmark and look at it daily, refresh it daily and see what's going on. But a high area of transmission is defined as more than 100 new cases per 100,000 people per day. Or 10%, more than 10% positive NAAT tests. And that NAAT, if you've forgotten, it's the nucleic acid amplification test, which is considered to be the gold standard for COVID-19 detection. So that's what it means to be a high transmission area. There are a couple levels below this, but this is, and Kim, correct me if you think I'm wrong, but this is where if you live in one of these areas or work in these areas, you should mask even if you're vaccinated.
Correct. And the CDC does have a really good map that where you type in your zip code and it'll share with you whether or not you're in one of those high density areas.
Right, and it can fluctuate.
Yes.
So you should look at it certainly on a weekly basis, if not more often. Okay, so here are some not so fun facts. So 73% of counties in the US right now are considered to be high transmission areas, which is, that frankly surprised me when I looked that up, and not in a good way. The driving factor, again, the Delta variant is more contagious. It has a shorter incubation period. The data here says that those infected with Delta infect an average of 6 people compared with the 4-person infection rate of the original version of COVID, and that Delta has caused at least 92% of new infections in the US. So those are some pretty stark numbers. And then if you want to look at the map, the red areas are the areas considered to be high transmission based on that data that I showed earlier. So again, not to be scary, but we just want to align what the guidance says with the actual data that we're seeing coming out. So, so this is where this is the map on the USA Today website that I referenced, but Kim is right. The CDC also has a great map that you can input your zip code into and find out where your area stands. Okay, so our format today is going to be the top 12 questions that we are hearing the most from clients around this issue, this intersection of masks and vaccinated and unvaccinated people in your workplace. So hopefully we'll hit on your questions, but if not, of course, we are here for you in the Q&A or at questions@dominionpayroll.com. Okay, so the first question is, can we bring all employees back to the office, but make the unvaccinated keep their masks on? And the answer is, in most places, yes. However, the CDC currently suggests that even fully vaccinated people should continue to wear masks indoors in areas of high transmission, since vaccinated people are still effective carriers and spreaders of the now dominant Delta variant. Your state or locality might have stricter mask requirements. And again, that's something that if they don't have it now, they might in the future. So try to keep on top of that, or we can help you with that if you have trouble finding the information. But if there aren't those requirements, then having different rules for vaccinated versus unvaccinated people is acceptable, since it's not based, since the delineation is not based on what's considered to be a protected class. Treating these groups differently is generally not illegal employment discrimination, and employers should not think of it as treating employees more or less favorably, but simply as following current public health guidelines. This should be emphasized when talking to employees about the different rules for those who are vaccinated or unvaccinated. Always keep in mind that some employees will be unvaccinated due to a disability, pregnancy, or religious belief. You should be careful to ensure that these employees are not harassed because of their vaccination status, which will be obvious if they are required to wear a mask when fully vaccinated employees are not. While preventing harassment of any employee who is unvaccinated is a best practice to maintain morale and productivity in the workplace, employees who are unvaccinated for these particular reasons have protections under Title VII of the Civil Rights Act and the ADA. So in my mind, one advantage of going full, I know it's a bummer, but to go back to fully masking regardless of the vaccination status, is that you won't have the unvaccinated people they won't be so obvious in terms of mask wearing. Anything to comment on here, Kim?
No, I mean, I think it's pretty straightforward. Keep in mind, so yes, you can treat these two groups differently. However, if someone is unable to get a vaccine because of a disability, pregnancy, or religious beliefs, then you need to provide that accommodation, such as wearing a mask. And that is considered a protected class. So you need to make that accommodation. Essentially, we would recommend, and this response kind of backs that up, is that treat the person who is unvaccinated by choice, right? They're unvaccinated by choice. We would treat them as you would somebody who has a disability, pregnancy, or religious beliefs, meaning mask up. But as Lesley said, they are not protected. So you can treat them differently. You could basically say they can't come into the office until they're vaccinated. But we would recommend that you treat them the same as you would someone who is disabled, pregnant, or has those religious beliefs.
And that said, I had a client who had a very employee who was very vocal about not getting vaccinated for like you said, discretionary reasons. So he didn't have a medical condition or religious belief.
Right.
Doesn't
Just
want to
a
get the vaccine.
personal choice. Yep.
Yeah. But he also didn't want to wear a mask in the office. And that was their internal policy. And they called me to see what they should do. And I said, you have every right to ask him to either mask up or not come into the office.
Correct.
So, which, but also treat all of those, to Kim's point, treat all of those instances, and hopefully you won't have too many, but treat them all equally.
Correct.
And go ahead and think about that process now and who's going to be part of the inner circle that will sort of evaluate each case as they arise. Okay. Quick legislative note, there have been bills introduced at the state level to make vaccination status a protected characteristic, and it appears that some governors may create protections via executive order. Now, my data might not be up to date. This is probably a week old, but so far only Montana's law has passed, but it appears to prevent employers not only from excluding unvaccinated workers, but also from asking them to wear masks if vaccinated employees don't have to. Looks like they don't appear to impact private employers, but yet nevertheless, you should check state law before making policies that treat vaccinated and unvaccinated workers differently.
Mm-hmm. And we see this is going to be fluid, right? So as time passes, we're going to see legislation come forth. We'll potentially see case law. So I think, again, this is going to be fluid. This is where it stands right now. And everything that I have seen, I think, was it last week or the week before, President Biden issued an executive order where federal contractors need to be vaccinated. And if not, they need to be submit to like weekly or biweekly testing. So we haven't seen it yet come down to the private sector, but A, we should anticipate it, and B, we should look to future legislation on this topic.
Right. And again, if you are having trouble wading through what your particular state or locality is mandating, just send us an email at questions@dominionpayroll.com and we can research it for you. Okay, question 2, can we bring back only vaccinated employees to the workplace? The answer here is it depends. Unless state or local law says otherwise, you could exclude employees from the workplace who are not vaccinated for reasons other than disability, pregnancy, or religious belief, since choosing to forego vaccination for other reasons is not generally a protected class or characteristic. So that goes back to my example a minute ago about the gentleman who just didn't want to get the vaccine or wear a mask. Employers who want to exclude unvaccinated employees will need to make reasonable accommodations for employees who are unvaccinated due to disability, pregnancy, or religious belief. If there is no reasonable accommodation that would allow them to be in the workplace without posing a quote direct threat, they too could be excluded. Whether a direct threat exists and if it can be mitigated is extremely fact specific. And we've gone through this before, but basically the EEOC, which is the agency that interprets the ADA, has some guidelines on its website about how to evaluate whether somebody is a direct threat. And it really, really depends on your industry, your setup, your physical space, how people interact, et cetera. If you have questions about that, we're happy to explain it. We did a webinar on it back in the spring, but that might be something we revisit in the coming weeks. Even when you could exclude an unvaccinated employee, we generally wouldn't recommend it. However, litigation around mandatory vaccination, which is in effect what an exclusion rule creates, is ramping up, and even pre-litigation expenses can add up fast. In many cases, an alternative approach of requiring unvaccinated employees to continue wearing masks and maintaining social distance will achieve similar results in terms of workplace safety. That said, any approach to bringing employees back will require a workplace-specific risk assessment. So that is a lot, but basically what they're saying is that you have the right to exclude people who are unvaccinated from the physical workspace if they are unvaccinated for reasons other than disability, pregnancy, or religious belief. So simply choosing to forego the vaccine is not a protected characteristic or class.
And keep in mind as well, if you have, so A, we're absolutely correct here where you can exclude those from the work site. But if you have disabled or pregnant or those who have a religious belief and they're not getting the vaccination, they can be excluded if they can work from home. That's an accommodation. So again, to Leslie's point is you want to establish what sort of accommodations could be made for those individuals. And if you're not able to accommodate them at the work site, are they able to work from home, work remotely?
Yeah, so I have a client who has a couple folks who have bona fide reasons for not getting the vaccine that we've documented. And the accommodation is either work from home or wear a mask 100% of the time, unless eating or drinking when you're on site. And they've all been, we haven't received any pushback on that. However, they have all asked, most of them have asked what's the sunset on this accommodation? And we can't answer that right now.
Right.
So it's TBD, hopefully sooner than later, but that's what we said 6 months ago. Okay, so in that same vein, question 3 is it illegal discrimination to treat vaccinated and unvaccinated employees differently? And the answer again is it depends. Different treatment that is reasonably related to workplace safety, such as having non-vaccinated employees continue to wear masks, is generally okay. You should make a concerted effort to only treat vaccinated and unvaccinated employees differently to the extent necessary to ensure the safety of all those in the workplace. Employers must make reasonable accommodations for employees who are unvaccinated due to disability, pregnancy, or religious belief. Treating these employees differently without trying to work with them would be illegal discrimination. Incentive programs also must allow for accommodations for employees who can't get vaccinated due to disability, pregnancy, or religion. So if you offer $100 bonus for getting vaccinated, or you throw a pizza party for vaccinated employees, an employee with a disability that prevented vaccination would need to be able to earn the $100 or attend the pizza party by doing something else that similarly advances safety in the workplace, such as wearing a mask, undergoing COVID testing, or taking a course on preventing the spread of viruses. Those are just our suggestions. You don't have to go that route, but you can't. What we're saying is you can't, because they have a reasonable medical or religious reason for not getting the vaccine, and that's not necessarily their choice, it's just the way it is. You can't say, sorry, no pizza for you. While employees who are unvaccinated for reasons other than disability, pregnancy, or religion are not entitled to these kinds of accommodations, it may make sense to provide them anyway, both to encourage the alternative safety enhancing behaviors and to reduce the likelihood that they will complain about how they are being treated. There is also the possibility that treating unvaccinated employees differently will have a disparate impact on those of a certain race or ethnicity. Disparate impact claims generally arise when an employer is trying to do something in the best interest of the company, but the methods they use ultimately harm a certain protected class. So in the case of excluding unvaccinated employees or offering cash incentives to those who are vaccinated, there could be a disparate impact on employees of color whose vaccination rates are lagging behind those of white employees. So I think, Kim, there, to that last paragraph, if you're not doing so already and you'd like to encourage people to get vaccinated, incentives are great, but also give them a couple hours during the day paid to go get
Correct.
vaccinated.
Absolutely. And if you're doing that, consider how available the vaccine is in your area. Because you don't want to put a time frame on it if it's hard for employees to get that vaccine. So I don't think that we're having that issue any longer, but it's worth considering. And then just to make sure that you are not running into that disparate impact, evaluate your results. Just continue to monitor your results to see the effectiveness of the approach.
Right. And if, maybe a rural area where somebody has to get a test or to get a vaccine, or if they have side effects from the vaccine and they need to take the day off the next day, you can, the American Rescue Plan Act, which you'll recall was passed back in March, we're still in its window of being able to provide that paid sick leave, which will be offset by tax credits. So you wouldn't even have to pay for that day that they miss. I mean, obviously they would miss a day of work. So you need to evaluate the impact on your business, but in terms of salary, you could have that day covered, as well as the time they take to go get vaccinated. So that law sunsets the end of this month. And so we're sort of watching to see if that will get extended given these latest developments.
September 30th, Lesley.
September 30th, sorry.
Yeah. It feels like it's September.
I know, my head is already in September. Thank you, Kim, I appreciate it. That's why you're here, to keep me straight. Okay, so moving on, and again, I apologize for all this text, you guys, but I want you all to be able to, if you do download the deck later, to have all the information. Okay, important reminder, you should also ensure that unvaccinated employees are not harassed by coworkers, managers, or customers, particularly if they have one of these protected characteristics that we've been talking about. You don't have a legal obligation to prevent harassment of employees who are unvaccinated for other reasons, but it is in the best interest, in your best interest, to prevent this, as any kind of workplace harassment is going to lead to loss of productivity, morale issues, and quite possibly bad PR. Alternately, do not discriminate against people who have been vaccinated and or are wearing masks out of an abundance of caution. So just don't even, to me right now, masks should just sort of blend in. We're also used to them. If someone's wearing a mask, if you still have a policy that allows people to wear masks or not, just treat everybody the same, and, maybe train your managers to keep an eye out for any type of discrimination or harassment. Okay, what do we do about employees who complain about wearing masks? And this is a short answer. Provide them with the CDC and OSHA's guidance, as well as any applicable state or local requirements. You can explain that the company is doing what public health authorities recommend to keep people safe, and that you, the employer, are responsible for complying with OSHA's general duty clause. So that's a short and sweet answer. Anything else to add to that one, Kim?
No, I think that probably what we'll see is just the frustration. For those folks who are wearing masks because of accommodation, that's one thing. I think where we're going to see a great deal of frustration is for those folks who have been vaccinated, who were told, hey, you get the vaccine, you can take your mask off. So I think that is part of it, and educating the employees who are complaining, who are frustrated. Why are we doing this? Why is it important to do it? Just educate them on what the CDC has said. Just like this slide says, education is key.
Yeah, it does feel like a setback for sure.
Mm-hmm.
So I don't want to have to wear masks in the office either, but it might be something that I start doing.
Mm-hmm.
Okay. Question 5 is, should we have unvaccinated employees sign a waiver? A waiver may or may not be useful or legally enforceable. speak with an attorney if this is something you are interested in. A waiver will not eliminate your general duty under OSHA to provide a workplace that is free from hazards. Also, most states' workers' compensation laws do not allow employers to contractually limit their liability for on-the-job injuries or illnesses. So is that something you're seeing, Kim? Clients looking into the waiver option, and what does the waiver say?
Yeah, and I have not seen that. It's not something we would recommend because, as you say here, it's not useful. I mean, it's just not legally enforceable. You've got a responsibility as an employer to provide that safe work environment. And if that employee potentially contracts COVID from there, or for any other reason, they can't waive their rights under that. So I don't see why this would be helpful. Now, I say that I'm not an attorney, and if your attorney says it would, well, then I would defer to them. But I haven't seen a lot of this, Lesley.
Okay. All right. So waiver is not a great idea, but if you have further questions about that, please let us know. Okay, question 6. There are no mask mandates that affect our business. Should we require employees to wear masks anyway? Currently, the recommendation is that those who are not fully vaccinated continue to wear masks when in public, and that even fully vaccinated people should continue to wear masks indoors in areas of high transmission, that being the key, since they are still effective carriers and spreaders of the now dominant Delta variant. And we have a question in the queue here that says, if both vaccinated and unvaccinated can transmit the disease, why should only the unvaccinated mask up? And that is a very important question, and we're sort of hanging in the balance with it. And the CDC comes out with this updated guidance after 2 or 3 months after saying that vaccinated people can go maskless, and now we're tightening up again. But the caveat here is in areas of high transmission. However, areas of high transmission are now in 73% of our counties in the US. Right, so I sort of feel like deja vu from last summer, where we had all those, you have to quarantine after traveling to a high transmission area. And that was easy to pinpoint at the beginning, but now that started to become more of, a more higher percentage of the country. So, so that's what we would suggest. If you if you want to follow the guidelines, then this is what they are right now. And again, they might change. Anything to add here, Kim?
No, I think you're right. I mean, some of these things we don't really have an answer for. I mean, I can see the point of the question, but if you look at what the CDC says, excuse me, they're basically saying, hey, both vaccinated and unvaccinated, everybody should mask up, because this variant is so highly transmissible. So the safest approach would be to require masks inside if you're not able to socially distance.
Right. Yeah, and again, it really depends on your setup and how what your industry is and how your team interacts with both each other and clients. And you also, if you are public facing and clients and vendors come in, now's a good time to look at your policy regarding visitors and to communicate that policy to them via signage, or if you have a meeting set up, communicate it ahead of the meeting so they can be prepared, because it's very inconsistent right now among workplaces. Okay, question 7. Should we make everyone keep wearing masks so the unvaccinated don't feel singled out? You could. I mean, we've sort of touched on this already, but masks can essentially be treated like uniforms given the current guidance and the fact that a large portion of the country is experiencing those high transmission rates. This would not be an unreasonable request. So I know, collective groan, but it is something that you should definitely evaluate and prepare for. Right now, I don't know what the enforceability piece of this looks like right now. CDC can't enforce anything, but OSHA can. And we have a lot of people out there who are parents of kids who can't get vaccinated yet. So anyone under 12 years old is they just don't have a vaccine ready for them. So if I'm vaccinated and I get COVID and don't know it, and then pass it on to my child,
Right.
that's an issue for me personally. I don't know what your workforce looks like in terms of that, but that's also a consideration. I think that's the main driver behind the CDC's newest guidance is that carrier piece.
Right. And I think that is a really good point. As we said earlier, I think the major pushback that you're going to get is from those who are vaccinated, because they were told not too long ago that should you get vaccinated, then you don't have to wear your mask. Well, now that guidance has changed based upon data that we know. And Lesley brings up a really good point. And I know just from my personal situation, we were masking up in order to protect my 12-year-old or my 11-year-old nephew who is unable to get the vaccine. So we were very cognizant about where we were, and we all masked up. So, that could really be a really good point. Again, educating your employee base and saying something like that, kind of, protecting our children, really, that could be a trigger that hits at home for folks.
Right. And we don't, nobody's going to like it. Human beings don't like to have something dangled in front of them and then have it taken away. And so that's definitely what it feels like speaking as a vaccinated person. However, this carrier situation is something that we just didn't have the data on back in the spring and early summer. And now it seems like we do. Oops, sorry. Let me get the question out before the answer. Question 8, can we ask for proof of vaccination? Isn't this a HIPAA violation or an illegal inquiry under the ADA or somehow confidential information? And the answer is you can ask for proof of vaccination unless there is a state or local law or order to the contrary. And we mentioned earlier that there are a couple governors or state legislators that are have proposed bills around this. So definitely pay attention to the headlines there. But in general, under federal law, when an employer is requesting or reviewing medical information in its capacity as an employer, as it would be when asking about an employee's vaccination status, it is considered to be an employment record. In such cases, HIPAA would not apply. The ADA will govern the collection and storage of this information. The EEOC, which enforces the ADA, has said that asking about vaccination is not a disability-related inquiry, though it could turn into one if you ask follow-up questions about why the employee is not vaccinated. Asking a yes or no question or requesting to see the employee's vaccination card does not violate any federal laws or require proof that the inquiry is job-related. Finally, just because employees think that something is or should be private or confidential doesn't mean that they can't be required to share it with their employer. Social security numbers, birth dates, and home addresses are all pieces of information an employee may not want to advertise, but sharing with the employer is necessary and required. Vaccination status is similar. However, all of this information, once gathered, should not be shared by the employer with third parties, except on a need-to-know basis. So, case in point, we have a couple clients that are using our iSolve platform to upload copies of employees' vaccination cards. Regardless of whether or not they have a mandatory vaccination policy or discretionary, they are asking people to present this verification so they can run a report and see the total overall vaccination rate across their team. The point here in this last paragraph is that you might get pushback from employees who have been misinformed or just assume that this is that you're not allowed to ask about status because it's protected. And what we're saying here is that you are allowed to ask. You just can't ask why if they are not vaccinated, because that might uncover some protected medical information that you just don't want to have to mess with. So there's that. And then if you do collect verification, so maybe you're asking employees to snap a photo of their card and upload it to iSolved or some other system, those electronic files, once they're uploaded, make sure they're deleted from emails or your hard drive of your computer. Like, say, for instance, you have your HR manager uploading those cards. Once he or she gets those cards and uploads them, then he or she needs to make sure that they delete them from their computer, because that's, you never know when that's going to turn up. Anything else to add here, Kim?
Yeah, so, one of the questions that we get is, okay, well, what if they refuse to tell me their status? Well, if they refuse to tell you your status, then you're going to treat them as though they're not vaccinated.
Mhm.
And they're going to have to wear a mask. And if they refuse to do so, you could discipline them accordingly. And then another question that we get is, well, can we share this with managers? Can we share the status? And that answer is yes. You need to share that information with anyone who needs to know. Needs to know meaning enforcing a policy, right? So if you've got a mask requirement for only those who are unvaccinated, then of course your managers need to know so that they can properly enforce the policy. I thought that was worthwhile mentioning.
Yeah, no, for sure. That's really important. And so that need to know piece, that sort of inner circle, that is something that I've seen clients have hiring managers or direct supervisors be the ones that upload the cards. I've seen central, some people have created a generic email address for people to send it to a single point of contact. If you go the manager route, I would definitely educate them on, maybe just share this deck with them and have them read it and field questions, because they might not know either. They might also assume that it's a HIPAA violation, and we want to make sure that that distinction is clear and that they are fully aware of what their rights are as an employer.
Right. And you probably want to invest some time in training them as to how to enforce any policy that you have. And what happens when an issue may escalate, like who should they notify
Yeah,
as
really
well.
Good point. Really good point. And also, I know we keep adding on to this answer, but I wrote a vaccination policy yesterday for a company that was mandating vaccines for a certain portion of their workforce because of the nature of their work and who they come in contact with. Essentially, they come in contact with a lot of children. And because a lot of those children are not vaccinated yet, they went this route. But there are other portions of this pretty large client that are not under that mandate. And so if you have that sort of hybrid model, definitely you want to educate all managers, whether they're in the mandated department or not, about what's going on, why the policy came to fruition, how it's going to pan out in practice, and what are the paths, like Kim said, what are the paths for questions, for submitting verification, et cetera. All right, question 9. Should we keep a record of who is vaccinated or make copies of vaccination cards? If we do, how long do we have to keep it for? So vaccination status, you'll want to keep some kind of record so you don't have to ask multiple times. I think that's the cleanest way to do it. But how you do it is up to you, unless there's a state or local law that has imposed any record keeping requirements. You may want to keep something simple like an Excel spreadsheet with the employee's name and a simple yes or no in the vaccination column. You could take a copy of their vaccination card if you want to go that route, but that should be kept with other employee medical information separate from their personnel file. And then OSHA recommends keeping these records for 30 years, regardless of whether or not they still work for you. So a quick note about that last sentence in that first paragraph: as a general rule and best practice, regardless of COVID, personnel files should be partitioned so that medical information is kept away from other more traditional personnel file things like resumes, performance reviews, et cetera. And that vaccination status would qualify there as medical information. So if you're using iSolved or some other electronic platform, those partitions are already there. And so you'd want to educate your folks in which tab to upload their card. If you're using hard copy files, then you're just going to want to make sure that if in the future a manager goes into my file and is looking for a performance evaluation and stumbles across my vaccination status or some other medical information, that's what you want to avoid. So that goes even in a non-COVID world. Oops, sorry about that. I'm just trigger happy today.
Mhm.
Okay, question 10. If we keep a record of who is vaccinated, can we share it with managers so they can enforce any policies based on that information, such as masking and social distancing? And yes, we touched on this later.
Yep.
Don't share it any more widely than necessary. You can share anonymized information, like 80% of our employees are vaccinated, but individual vaccination statuses should be treated as confidential, even if the fact that they are wearing a mask to work seems to reveal their status publicly. Managers will need this information if they are expected to enforce vaccination-dependent policies, and employers should train them on how they should be enforcing the policies and how and when to escalate issues to HR or a higher level of management. So definitely have your managers back. Don't leave them out there with unclear information, conflicting information, or a feeling of not being supported by upper level management, because it's not a comfortable topic for a lot of people, and managers, they just want to do their job and run their department. And this is another thing that's we're asking them to do. And so definitely have their back and support them with this company-wide. All right, question 11. If an employee has had COVID, is that as good as being vaccinated? And the answer is scientists don't currently have enough data to say definitively whether natural immunity is as good as the vaccine, but the CDC right now only differentiates between those who are fully vaccinated and everyone else. So if you are following public health guidelines, someone having had COVID in the past is not equal to being fully vaccinated. I think that
Pretty straightforward.
Yeah, that's a misperception, I think, among some folks that I think is important to clear up. All right, last question. Can we forbid employees from wearing masks, assuming no laws say otherwise? So this is sort of the inverse of what we've been talking about. Theoretically, yes, you could ban them from wearing masks, but this is not a great idea. Since it's in opposition to current federal guidance in most of the country, it is likely to result in complaints to OSHA, bad publicity, or maybe even a lawsuit. It would also require accommodations for many employees. Even if masks are not required by any law, we recommend allowing employees to wear them for any reason or no reason at all. So that's kind of a frustrating answer, but essentially it's not a great idea to ban masks right now. Unless I can't think of, maybe Kim, you can think of a situation.
Right. I can't think of one other than work remotely. If you work remotely, you don't have to wear a mask.
Yeah.
I don't know. Maybe if you're outside, if your work is outside, you might not have to wear a mask.
Right.
But other than that, I can't think of one. Maybe somebody on the can think of it of a reason and put it in the Q&A.
Yeah, I'm sure there's some argument to be made out there based on the nature of the work. Maybe it's a customer facing communication issue or something like that.
Could be. Yep.
Certainly if somebody is hearing impaired and they require lip reading, that's a situation that you need to navigate. But in general, it's a bad idea to ban masks at this point.
Yes, right.
Okay, that comes to the end of our presentation. I know we're bumping, oh, we still have 10 minutes.
Yep.
Not so bad. So I just wanted to read a comment from Lisa, and I know Lisa's been very patient. She submitted this at 11:08. Thank you, Lisa. She chose other in the poll for the first question about a mask policy because they have a mandatory vaccination policy and all staff are vaccinated. We don't require masks to be worn by vaccinated staff except during public performances. So Lisa works for a local cultural arts venue here in town. We have just implemented a vaccination requirement for our patrons, and all staff and audience must mask regardless of vaccination status, except for performers who unmask in the wings and are more than 10 feet from the audience. It's a lot.
Wow, I think that would be a lot.
Yeah, I mean, I was just in an airport last weekend and it was 100%. I mean, I only saw one person who confidently strode through the terminal without a mask on, and everybody was fine. It was relatively busy airports I was in, and it made me a little nervous here and there because I hadn't been around that many people in a long time, but everybody just wore their mask. And I think, the trade-off is that we got to go on vacation and fly somewhere and have a great time. And so I think right now you really just sit down with your trusted advisors internally and evaluate like Lisa has done, the different types of audiences and populations that are going to flow through your space, and what's the best path for those subgroups or for the whole group as a whole.
And kudos to Lisa, that is a lot, and that you were able to roll that out. Congratulations. That's great.
Yeah, I'd be interested, Lisa, maybe if you think of it one day, drop me a line about how that's working in practice as you get into your season. Similar, I know Broadway is, I don't know if things have changed now, but I know earlier in the summer that when Broadway announced they were opening, it was going to be a fully masked audience at the very least. And then I'm not sure what the vaccination policy is now, but as we've said this entire webinar, things are going to be fluid. And if you have customers that object to your policy, then you have every right to enforce that policy or deny them service. And you should educate your frontline staff about what your policy is. And then again, make sure they are supported when they need to go to bat for the organization. Okay, we have another question here. We have a majority of employees who refuse to get vaccinated. We service long-term care facilities, assisted living facilities, who are now stating they will not allow our technicians on site without requiring vaccination. How do we encourage our staff to get vaccinated? That's a great question. I've sat in on many uncomfortable conversations in the last 4 months with employers who are trying to encourage their employees to get vaccinated. Kim, do you want to take this one?
Yeah, sure. Well, I think first education is always the key. And I'm sure, Melissa, you probably have done this, but, point to the success rate of the vaccines that are available. And, the likelihood, like 0.00, that you'll be getting COVID once you, take this vaccine. I would also point out, its relation to the Delta variant as well. I just think I would go back to really what their role is. Their role is to take care of these patients, these guests in the facility, and they've got a responsibility to do so in a safe, caring manner. And the best way to do that would be for them to get vaccinated. Now, I will tell you, that's probably going to be a hard sell. I'm not going to lie, a hard sell right now because of the CDC now saying everybody needs to wear masks. But eventually, we have said this is temporary. It doesn't seem that way right now, but it is temporary. And, eventually you want to be able to, we are all going to get, as long as you're vaccinated, we're all going to get to that point where we can take our masks off. And that should be the goal. I think, because they've chosen this field, they've got a responsibility to protect those individuals that they're serving. That would be that, and just educating with the data that we have. That would be the approach that I would take.
Yeah, it's interesting. I don't know the answer to this question, but I in the future, and whatever that means, 6 months out, 12 months out, will unvaccinated people still be asked to mask up in some capacities? I guess it depends on our level, once we get to that magic number.
That herd immunity. And I'm not a doctor, so I mean, when or if we get there, but I think we have to have a certain amount of people vaccinated first. But again, I just, for those folks, particularly in the healthcare, I would lean on their responsibility to protect and take care of their patients, and getting vaccinated is one step to doing that.
I need to research herd immunity at this point, now that we have this new information about the Delta variant. I wonder if it's changed, if like the numbers have changed at all, or the threshold. Okay, Anonymous says Broadway policy is fully masked audience and fully vaccinated performers, front and back of the house. They have a friend who works on the play Wicked.
Wow,
Cool.
that's
Thank
cool.
you. Yeah, that's great to hear. Thank you so much. And Melissa, if we didn't fully answer your question, or if you need additional assistance, just email questions@dominionpayroll.com and we'll try to help you out there. I can,
Yeah,
it's
it's
almost
hard.
yeah, it's akin to, like, say I'm a municipal bus driver and I need to have a clean driving record and a monthly drug tests to make sure that I'm safely driving people around. I mean, I know that that's not quite the same as a shot in the arm, but certain occupations, for years, we have had requirements for people to, pass certain tests or take certain measures. Hospitality employees have to wash their hands.
Sure. And to follow up, Melissa, because I really can feel your pain. You can mandate it, meaning they have to get vaccinated. You could choose to take a step, like we've seen with some of the federal government, where if they're not going to do so, then they have to get tested regularly. And that's uncomfortable. I would, if you're going to go that route, you probably want to talk to your legal counsel. But that's something that most, I would think, would be doable based upon your industry.
And you could also, I think those are really good tips. You could look into, maybe you've already done this, but incentivizing, cash is king. Maybe it's just maybe for those that are on the fence, it's just a little push over the fence with $50 or a day of PTO. There have been some sneaky things that I think I've seen corporations do. If for some reason, if you lose an account based on the fact that these assisted living facilities will not allow your technicians on site without this requirement, then you might cut their hours because you don't have work for them to do, because they are compliant with your customers and your partners' policies. So, as long as you do that consistently among all people and don't sort of pick and choose who you sort of discipline in that way, because that is the business case. You're losing clients, you're losing business. Like the NFL, I think maybe you guys might have read in the last couple of weeks, they announced that they're not going to mandate the vaccine, but if a team forfeits a game because they had a COVID outbreak, they don't get to redo that game. And since there are only 13 games in the football season, that's a major blow too. So that's sort of, been some sneaky ways that companies and organizations have sort of avoided mandated policies, but are also making it, they're trying to sweeten the deal if you do get vaccinated. I'm trying to think, I saw another interesting one the other day. I'll have to remember what that was, but it was very creative. But yeah, I'm not trying to necessarily penalize or take money away from your employees, but I think you have a pretty good case. I would run it by counsel before you announce, and also commit to figure out what you're going to do if somebody just continues to refuse, and how you're going to treat that situation. All right. Well, I don't see any other questions. Now's your chance, everybody. Last call for questions in this format. Of course, you can always submit it to the email address that's on your screen right now. Kim, as always, it is a pleasure. And even though I don't like the fact this topic is back, I love the fact that you're still partnering with us on these webinars, you and your colleague, Emily. And who knows what will happen in the next several weeks, what topics we'll be discussing here.
It's my pleasure. I'm happy to be here. So thanks for having me.
Yeah, of course. Okay, one quick comment here from Anonymous. I have a friend who works in a facility where they informed their employees that if they did not get vaccinated, they would be fired. It's an option. It's the riskiest option. But like we said earlier in Melissa's case, you can do that.
Right.
I would make sure that it's consistent, applied to everybody equally. And then document everything. What else should we add to this? Kim?
So if you're going to go down this path, you need to think about the impact it's going to have on your workforce as a whole. You might have, an uproar where you have a lot of people leave because of this decision. So it's going to be very important if you decide to go down that path. And we can't really speak to, where this person's working, but if you're going to choose that, you need to just, really think about A, the impact on the workforce, B, what happens if you've got some folks who have an adverse reaction. You could have increase in your workers' comp claims, for example, because of the mandating, if something doesn't, if something doesn't go well. And then, again, do so under the advice of counsel. That would be my advice.
Yeah, that's a good point about workers' comp. I forgot about that little wrinkle. Yeah, anonymous, not sure what type of industry that your friend works in, but I'm assuming they have a really good reason. Hopefully they've consulted counsel and have a clear policy in place, because it is tricky. But they are allowed to do that. They just need to make sure they have their ducks in a row. All right. Last call for questions, everybody. These have been great questions and anecdotes. I really appreciate it. I think these webinars are much richer and more robust when we have interactivity with you all. And we appreciate everyone sticking with us through now. I don't even know how many months we've been doing these webinars, but a year and a half, let's say. And we wouldn't be able to do them without you tuning in and listening and your ideas and questions. So stay safe out there, hang in there. Let us know if you need any help. And we will be back in 2 weeks with another topic to be determined. Thank you, Kim. Have a great afternoon.
Thank you. Stay safe, everyone.
Bye-bye.